Hello everyone, welcome to my channel. I am Katie Montgomery, if you don't know already. I don't know why you're here if you don't already know, because obviously. But today we are talking about trans healthcare in the UK and particularly Scotland. And I am here with the lovely...
Oh, me? Is that the signal to me
That's
where I
you! Who are
introduce
you, mate?
myself?
Why are
You
you
see, I'm
even in
not a
here?
professional YouTuber, so I didn't know that that was a throw to me. How very embarrassing. Hi, I'm Josie Giles. I'm actually a writer, performer by trade. That's my work. But where I spend a lot of my political energy now is around trans healthcare campaigning. So that's what I'm here to talk about today.
So I've got you down. So we were just chatting before the show started. I've put you down as Dr. Josie Giles, but then you just wanted to make it clear what type of doctor you are.
Yeah, to be absolutely clear, I'm a doctor of poetry. Like I'm not above like putting Dr. Giles like at the bottom of an email, when I'm emailing the NHS and
Yeah.
lobbying for trans healthcare changes, I will wield it as a weapon. But to be absolutely clear, I am not a medical doctor and nothing in this hour-long chat constitutes formal medical advice.
Have you ever been in a situation where they're like, "Is anyone here a doctor?" And you just have to be like,
No, but I have had the very pleasing. So is it Miss or Miss? To which I get to reply, oh, it's Doctor actually.
"Yeah, fuck you, mate." Amazing. Oh, that's pretty good. But yeah, so we're here to chat about healthcare in the UK. So I presume that lots of the audience will be from the UK or at least be aware, but lots of people might not. And it's trans healthcare. When you don't know what trans healthcare really is, you might just think, oh, well, it's just like you just go to the doctor and then they give you a thing and then you're done. And they don't realize that it's often like some kind of Kafkaesque nightmare hellscape. So, like, I know about that, but would you like to sort of summarize how you feel the sort of state of healthcare in the UK or Scotland, or what's the difference, or, what's...
Sure. In terms of trans healthcare, there's not a tremendous amount of difference between Scotland and the rest of the UK at the moment. There's some small differences. An important thing to understand is that Scotland is a devolved, for people who don't, Scotland is a devolved nation within the UK.
If you've not heard of Scotland.
If you've not heard of Scotland, you go north and we're a little bit north of Newcastle. And that means that we have our own parliament and we have that some areas of law are devolved, which means that we have kind of a level of control over them. And generally health policy is one of them, which means that we do have a Scottish NHS and it operates sort of like the NHS for the rest of the UK. But there are policy differences in the kind of lobbying process that I'm involved in is separate from what happens in the rest of the UK. And that can create some interesting differences, sometimes really relevant, such as at that point where due to the legal action, was it last year or the year before? I've lost track of time. When trans youth healthcare was essentially shut down.
That was 2020.
England, that was 2020, it was that long ago.
Yeah.
So that was with everything that happened around the Bell decision. The decisions that were made by NHS England not apply to NHS Scotland, and Sandyford, which is where the Youth Gender Clinic is in Glasgow, did not stop providing healthcare in the same way that Tavistock did, for example. So sometimes the differences are really important.
Yeah.
Well, it's something. I wouldn't exactly say that Sandyford is a bed of roses for trans youth.
Yeah, it's not good. Okay, it's not horrifically evil like the Bell decision was.
So I've got into the really boring like policy niceties now, but let's give like a really broad picture. So for people that don't know, the first thing that happens often with trans healthcare in the UK is trying to get a referral from a GP to a gender identity clinic or a gender identity service, as they're now trying to kind of change the name to in some places. That's often people's first port of call. Sometimes people stumble at that first block if they meet a transphobic GP or an ignorant GP or a GP that's bad at admin. Sometimes that means that they can struggle even to get a referral to help.
I've heard so many horror stories. I mean, myself, when is that what we say? I, myself, me, myself, and I, when we went to get a referral to the GP, I had read online that it can be a struggle. So I like wrote a little letter to read out because I was nervous too. I was like, oh, I'd like to be referred to, this place and stuff. And he was like, oh, do you have sex with men? Like, as his first question, I was like, why is that relevant? But then he was like, after I had explained my sexuality in the minimum detail I would sort of satisfy him, then he was like, oh, how do I do it? And I was like, okay, go on Google, type in the name of the clinic. And like, he was willing to do it, which was nice. But, I know some doctors have just said no, or doctors who have referred them to like the mental health specialists, or doctors who have said they're going to refer and then just never did. So, yeah.
So those are really common stories, and that kind of gives it a brief. And if you consider that being like one version of ways that trans healthcare can go wrong, and then you keep multiplying that by 10 times and then 100
this
times,
isn't even step
those
one
level of problems at every level of the service. It's important to say, by the way, that for most gender clinics in the UK, you don't actually need a GP referral. Most gender clinics in the UK you can self-refer to. Check their websites. Some of them you can't. I believe, I could have this wrong, but I believe Chalmers in Edinburgh, which is where I am, you can't self-refer, and that creates an obstacle. But sometimes you can get around a problematic GP. A good GP can be a decent ally in your transition. So we get this referral to the gender identity clinic, and then we get to the thing that people have become really aware of in the last few years, which is the massive wait times between being referred and seeing somebody at the gender identity clinic. And those wait times have ballooned over the last decade from months to years. I'm fairly sure and confident in saying it's just generally about a minimum of 3-year wait now, but it could be up to 5 or longer before you're seen. And what's really key in the UK system, especially compared to a number of other European countries and especially to North America, is that you can't actually get any trans healthcare until you're at the end of that waiting list, that everything is gate kept behind that meeting with the GIC, behind being met by the GIC. Not just hormones and surgeries, but also in many cases, things as simple as speech and language therapy to help with dysphoria related to voice, or
even just like mental health therapy and stuff that's specialised.
I mean, that's almost non-existent. There's almost is no mental health therapy on the NHS for trans people outside of the GIC, or hair removal, which is often a really long, time-consuming and expensive process for trans feminine people. Even that is kept behind the GIC. And so people are in these long waiting lists and they can't get any of the NHS care until they're seen. And I think that's really key for people to understand, because when we're faced with the problem of waiting lists, there's a temptation then to say, well, if we just fund the GICs more, if we just get more gender doctors, then maybe we can shrink these waiting lists. But that's not true. The problem is created by the need for a psychiatric diagnosis in order to access even the most basic elements of trans healthcare.
And I think that's it's important to point out, like, if you're talking to someone who's like, right, I want to solve trans healthcare, I'm going to help you, oh, let's do more fun. It's good to explain that to them, but it's also important to explain to people who want to hand wave this away, because I meet people all the time and I'm like, well, we don't really have trans healthcare in the UK, like practical access to, for most people don't have any access to trans healthcare for like the next half a decade. So we need to do something about that. And they're like, oh, everyone waits, the NHS is underfunded. And like, no, it's not just underfunding. It's specifically designed in a way which holds people up. And I think that, I totally agree that's important. And I guess to just elaborate on that as well, like talking about facial hair removal, one of the excuses to keep this model, which is created by cis people in order to like hold trans people up, is what if people regret it? And of course, we can go into how the regret rates are super low and all this kind of et cetera, et cetera. But we need to break these things down into separate components as well, because it's not just trans healthcare as like one package. You don't just like turn up and then they give you all these things. And it's each of these is a separate individual step, which different trans people may want or may not want. And each of them have a different gravity to them. You know, like for laser hair removal or something is, I mean, oh no, what if someone regrets it and they, like, after 6 months, they think, oh, maybe I don't necessarily want less beard than like, it's so mild compared to, like,
I mean, it's going to grow back at some point, probably, if you continue to have testosterone in your body, like, it's going to grow back.
So this is one of those things where having it behind any gate is completely ridiculous. Like, you could go and pay for it privately and you don't need a diagnosis. So why would you need a special? So no, this isn't just a doctor seeing you. For sure, you still need a doctor in front for the system. Like, you need the GP to say, but the GP could diagnose. Anyway, sorry.
But no, those were really important cases. And I think that's really good to get into. And it helps to understand, especially for people who, it helps to understand then, especially for people who are now on the waiting list. And I apologize to people, because you told people this was going to be a cheery one. We're doing the miserable bit first, and we are going to move into like what you can actually do about this.
There's going to be some good stuff at the end.
Even when you're seen by the GIC, what people have to understand is that then there's going to be another wait for the next bit of stuff. It might be another wait for another appointment to be prescribed hormones. If you're very lucky, in some circumstances, you might get a prescription after the first appointment, but that's quite rare.
Unheard of, yeah.
But there's going to be a wait as you're referred for hair removal. There's going to be a wait as you're referred for speech and language therapy. There's going to be a wait as you're referred for surgeries. So when people, is exactly as you're saying, when lots of cis people say everyone waits on the NHS, we have to wait to be even seen by a medical professional.
Yeah, it's like a cascade of waiting. You wait to wait, and then you wait to wait to wait, and then you wait to wait to wait. Yeah, because like, if you think, often cis people think, oh, you just go and have genital surgery or whatever, and it's like, that requires first a wait to see a GP, then a fucking huge wait to see the GIC, then a wait to get the healthcare you need before you can even consider the waiting list for surgery, then a further wait for the like pre-consultations, then another wait for the actual waiting list. Like, this is like 10 years. And
a good way for people to think about this then, to make sense of this, is as an explicit issue of discrimination within the healthcare system. It's a healthcare inequality.
Yes,
cis people and trans people have different access to the same kinds of healthcare. If somebody went to their GP with a non-gender related speech issue, their GP could refer them to speech and language therapy. If they come with a gender related issue, then their GP sometimes can't refer them to speech and language therapy because of how healthcare policy is set, or even if technically they're allowed to, they may not know that they can, and even if they can, gender-related speech and language therapy may not be funded in their area. So it's direct discrimination by the NHS. And that when we stop, like, when trans people actually stand up for ourselves and say we deserve to be treated like anybody else, and you think like that, lots of other stuff becomes clear. At the moment, for example, breast augmentation, for the most part, is not available for trans women on the NHS. There are ways that it can happen, and I'm not going to talk about them in detail, but if anyone's interested in that, DM me. But it is available for cis women who've had a mastectomy. That's a gender dysphoria issue. When people have breast reconstructive surgery following mastectomy, that's a gender dysphoria issue. There are other forms of gender dysphoria than trans related, but when we have that issue, we can't get the same surgery. So these are direct discriminations.
Yeah, and it is quite clear. I mean, especially the voice therapy one is so clear, because all of the standard arguments you see against this just don't make any sense. Oh, what if you... Like, I mean, I guess this voice therapy is maybe more targeted to trans women, but I guess I don't know enough about trans men's transition. I'm really sorry, guys. I should get more trans men to come and talk about their side of the healthcare. But for like, when they say, "Oh, what if you?" No one can regret learning how to speak differently, because you can just not speak differently. And it's like I saw an NHS voice therapist like after years, and she was just the voice therapist for my city. Like, she wasn't a special one trained for trans people, and all the people in the waiting list were cis people, mainly kids. So it really is the same services, the same expertise, the same. But it was honestly like 5 years before they, from the point of me asking my initial referral to seeing this voice therapist. So actually, I will just say another thing about mine. So when you were saying about you potentially could technically get hormones on the first appointment, but it's very unlikely. So I went private. I was very in a privileged position to be able to pay for private healthcare. So when I got to the GIC, the NHS, I had already transitioned. I'd been full-time for over a year. I'd been maybe 2 years. I'd been on, hormones for ages. I'd already had a diagnosis from a professional, all of this kind of stuff. And on my first appointment, I didn't even see a doctor. They just made me fill in a form and said, see you in 6 months. And on my second appointment, I saw a doctor and he just asked me all the same questions that were on the form, and asked me about my sex life again, and then said, see you in 3 months. And then on the third one, he was like, because you're already on hormones, we'll give you a prescription. It's like, you could have done this 9 months ago.
This is highly variable from gender clinic to gender clinic. It's also highly variable from patient to patient, and
Yeah.
other forms of discrimination, particularly around race, around disability, around neurodiversity, often tend to play into this as well, in terms of people being regarded as more complicated or more difficult, or having non-standard transitions. That can often cause delays. Rewinding slightly, just a quick note for the boys, the lads, the guys, the masks,
Jesus.
the geezers. You can get voice therapy for gender-related issues as well. Lots of transmasculine people don't know that, but please, you can, if you want it, ask for it. If you have issues related to your voice, if testosterone hasn't done what you want it to do for your voice, or you're struggling even with pain around your voice, or if you're not taking testosterone and you still want to modify your voice, you can access gender-related speech and language therapy through the NHS, and there is stuff that you can do. So, I think what you brought up there as well is another useful thing to point out, is that the crisis in the NHS around trans healthcare, which is one element of a broader crisis, but very specific to trans people, has also created a two-tier system within trans healthcare, a class system within trans healthcare, which
Absolutely.
is that, because if you can afford forms of private transition, then you can access trans healthcare more quickly. So we have really another form of discrimination there.
Yeah.
I had a not unrelated journey to yours. I did a little bit of private trans healthcare. I stopped being able to afford it, and then I self-medded for a while. And I was self-medding at the point that I was seen by the NHS. And because I was already kind of transitioned, I did actually get an NHS prescription on my first appointment, but I also came in very, very, very prepared. So
because
I don't know, but
I always think like, I was privileged enough to be able to do private healthcare, and that helped with the NHS side of things, and obviously helped with my entire life. But then also, I am confident, and like you say, things like race and disability and stuff come into that, and I don't have any of those extra, but there are so many things that mean it is easier for me, and it was still an absolute fucking nightmare for me. So that we've only covered like one of the whole cascade bullshit of problems that I've dealt with in this, and it must have just been so much easier for me than so many other people. And it's just there is definitely it's intersectional discrimination on just healthcare for trans people, like disgusting.
And I think also what people in the waiting list have to understand, and again, this is very doomy, but like, even once you're through all the waiting list, even once you're through the hoops, even if we discount the waiting times, very, very often the quality of care that you can receive at a gender identity clinic is very poor. You will be astonished at the ignorance of the clinicians you see about very basic issues to do with your healthcare. There's a whole range of symptoms, effects, side effects that are really quite well known in trans community that often clinicians don't even know about. So this is just going to get slightly explicit for people. So I'm just giving a content note for genital related discussion for the next minute. I don't know. It's not going to get into detail. But genital pain for trans feminine people on hormones is quite a common issue. I do a lot of peer support for trans people generally, for particular trans feminine people. A friend of mine got in touch talking about this, said that she had gone to her GIC to talk about this, and the clinician that she saw at the GIC said, "Oh, I've never heard of that before. I think maybe one other person came with that problem, but I've never heard of that before." Like, if you log on to a trans femme Reddit, it's like every 5th post. Seriously. So
I know, it's mad.
So that's the kind of poor healthcare that we're dealing with, even once we're through all of that.
Yeah. Well, I mean, talking of poor healthcare and bringing it back to me, because that's the most important thing here. I I had FFS, facial feminization surgery, privately. And in that time, I was also still going through the GIC system in order to get GRS, genital reassignment surgery. And as part of that, I was given this like therapist, gender therapist, or whatever they're called, named professional, or whatever their official role is. And I was just, I had understood that she was just a normal therapist, and I swear that she just told me all that was the case. And I said to her, like, oh, I've got FFS coming up and I'm fucking terrified. I think, I described this scene in The Simpsons where Homer's going to donate his kidney to his dad, and then just as they're about to do the surgery, turn around and the window's open and he's just like running over the horizon from fear. And I was like, that might be me. And she was like, oh, blah, blah, whatever. And then like 3 months later, which is like lightning pace in GIC terms, the doctor rang up and was like, I hear you're considering detransitioning. And I was like, what? Where's this come from? He's like, oh, apparently you're too scared to have surgery. And I was like, and you can't lose it. You can't, because they might do something. So I had to be like, no, I'm just nervous about a private surgery that you aren't even funding. And I'm going to do it because I've already paid for it. It's just so insane. And like what had they not encountered trans people being afraid of surgery before?
Your story there hits another really important stuff about this, which is it's very, very dangerous, actually.
Total breach of privacy as well.
It's a breach of privacy, which is, we mentioned earlier, the lack of any counselling related to gender identity outside of the gender identity clinic. Within the gender identity clinic, it's very hard to have any of that support independent from the assessment process. And because of stories exactly like yours, there can be no bond of trust.
Yeah, I just had to lie to her every single time.
Because what happens if you think that anything you say might be part of your assessment is you can't tell the truth, which means you cannot access good therapeutic support. And I've explained this to I've been in meetings with gender clinicians saying this, and they don't believe me when I tell them that, because they don't want to hear that what they're doing is actually harmful.
Honestly, so many. I cannot stress how many people message me and they're like, this has happened, I feel like I have to lie to my doctor or whatever. And I just, when people ask me this, what I say is, well, it is important to trust doctors, and lying is generally a bad idea when it's healthcare. But the reality is that lots of these people, lots of them don't want to help you at all, or they want to hold you up, or they want to make you adhere to some bullshit stereotype they have in their mind. And lying is the only way to do it. And that can come in the form of telling them you're not scared of a surgery when you are. And also, like an absolute classic, it is a meme amongst British trans women that when you go to the gender clinic, you wear a dress and you put on makeup, because if you don't, it could count negatively towards your healthcare. And the idea that therapists would roll their, or people involved in the GICs would roll their eyes at that is just so ridiculous, because it's like a fact.
It's well documented. We know it.
Every single person.
And even if there are now people working within the GIC that don't have those prejudices, we've had to learn that over generations. Yeah. Speaking of people messaging, I'm just again rewinding slightly. I dropped the trans femme genital pain bomb into the chat earlier. And again, if anyone wants to talk about that, you can hit me up on social media. I'm at Josephine Giles on most of them. I talked to a lot of people about that stuff. I did a talk about related issues for the Gender Community Lending Library last weekend, so it's something that I talk a lot about. Again, not a medical expert. Whenever I mention it, there's a lot of people that are like, oh, I didn't know anybody else ever had that problem. So there you are. So we're halfway through, and we've done the moan. We've covered a lot of the moany bases.
Have we covered all of the moan? Is there more moan?
No, there's an infinite moan. It's an infinite moan. And what I hope we've built a picture of is an understanding that the health system, the trans health system in the UK, is designed to prevent trans people from accessing healthcare. That's a really important thing.
It's not even negligent. It's malicious.
Yeah, it's malicious.
Yeah.
And It's a site where many of us have experienced abuse, where we have experienced racism, where we have experienced ableism. And when I say abuse, I don't mean that word lightly. I mean actual psychological abuse, actual physical abuse that many of our peers have gone through. It's not a system that can stand. And this, and we're going to move, I think, start moving towards solutions now.
I've got one more complaint before we do,
Yeah,
just because
okay,
I want to
let's do
just
that.
vent out another issue that I
Yeah.
faced. So I'm not trying to make this all about me. You're welcome to put your issues. I just think it's good to have examples, and I think it's good to put examples forwards from people who are like on the other side and who had a comparatively easy ride, and be like, this is what I experienced, and it's worse for 99% of the trans people in the country, I think, than
Yeah.
the stuff I faced. But I had a situation where after the GIC discharged me, done stuff, I moved to a new location, changed my GP. I went in when I was at the end of my prescription time, 6 months of estrogen, and I was like, oh, can I repeat this prescription? And the doctor was just like, no. I was like, why? I only have enough left for like 4 days or something. And I've been on this for like 5 years now. Like, what are you doing? And she was just like, oh, we'd have to write to the GIC. I was like, they've discharged me. You've got the letter they wrote saying continue my care indefinitely. What? And she was just like, well, I don't know. I don't feel comfortable doing that. And so I ended up doing a flipping middle class white woman on her and was just like, well, I'm not leaving then. And literally just sat there for like an hour, and she decided to go off and do a meeting with like all the other doctors in this practice and come back and was like, oh, okay, we can give you a renewal, but then only gave me 1 month, and they refused to give me longer than 1 month, so I had to go every single month. I had to request a new prescription of the same thing.
Yeah.
And it's just, that's malicious. It's just so utterly pointless.
It's not an uncommon experience.
Yeah. Anyway, right.
So what do we have to do about this? All of this is why you might now see the slogan "Abolish the Gender Identity Clinic," which is a slogan that I fully ascribe to, and I think it's something that we really, really should be demanding. And what we mean by that is we have to end the system whereby trans people have a separate stream of healthcare that is gated by a psychiatric diagnosis. And that's what Abolish the GIC means. It means our healthcare shouldn't just sit in this one psychiatric system that is poorly funded, that has been a site of abuse and malicious treatment, and that because of its siloing within the NHS means that we haven't built understanding across NHS systems of what gender identity related healthcare should look like. And that's why that system has to go. And as part of that, we have to end the need for a specialized psychiatric diagnosis as the gateway to all trans healthcare. And those are two very simple demands, very basic demands that have to be at the foundation of what we're doing. Yeah. One way that we can accomplish some of the latter demand, the diagnosis, is looking, and I think this is some of the shift that's happening now, is looking at the new the name for the disease that we have, which used to be named transsexualism.
Yeah, I got an F64 transsexualism diagnosis.
Nice, wear that badge with pride. I mean, we all are legal transsexuals because transsexual is still the term within the relevant legal acts. So we're all transsexuals. However, that got shifted in later updates to gender identity disorder. I think gender dysphoria has been in the mix in some jurisdictions.
Gender incongruence?
Right. So the World Health Organization has now moved things towards gender incongruence. And that is now, who cares what they're called? But if you actually go to the gender incongruence diagnosis, it's really worth looking at. It essentially says somebody has gender incongruence when they want to transition. It's the diagnostic criteria is essentially now wants to transition, which is a really useful diagnostic criteria for us, and a way of de-psychiatrizing trans healthcare.
That's a good word.
It is a good. It's not. It's part of it's part of a general like resistance to psychiatry movement, and there's a whole other movement that we could talk about that this is related to. As part of de-psychiatrizing, if health institutions continue to insist that we need a diagnosis in order to access anything, which I'm would say we should still try to oppose wherever possible. The gender incongruence diagnosis is broad enough and open enough that there can be training within what's called primary care. So that's GPs. It can even be nurse practitioners. It can even be pharmacists. You can train. You can skill people up within primary care to be able to say, oh, this person has gender incongruence, and it's not actually a highly specialized thing for me to say that they have gender incongruence, because they've told me they need to transition and they've consistently said that.
It's not a complex mental health condition with loads of support required, which is how it was traditionally viewed as, and how lots of that's where the mainstream discussion often is. I mean, like every 5 minutes, someone on Twitter tells me that they think being trans is a mental illness. It was obviously because they're dickheads, but like it is part of the social understanding of being trans, and it is an important thing to push back on for a number of reasons.
I take a slightly different position on that.
Go for it.
I mean, if people don't want to identify as mentally ill, that's completely fine. I'm mentally ill in all sorts of ways. And maybe like the gender dysphoria that I experience is one of them. Maybe I think it can be quite useful to differentiate between being trans, which is not a mental illness, having a gender identity different from the sex that you're assigned as birth, not a mental illness, and the mental distress related to that, we can classify within mental health if we want to classify it within mental health. One of the reasons that I do that is I am mentally ill in all sorts of other ways. I also have developmental disorders in other ways. I was diagnosed autistic as a child. I work with that diagnosis as well. I have had various forms of depression and anxiety throughout my life, some of which are related to being trans, some of which aren't. My community is a community of mad people, of mentally ill people, and I don't want to separate myself from that community. Those people are my people, and I'm part of them. And I don't consider being mentally ill to be being a lesser class of person, right?
I think whenever I, have this argument, they'll be like, oh, trans people are mentally ill. I always say, well, that's false, but also it wouldn't matter if they were.
Right.
Because, I mean, what's the argument here? They're mentally ill, so they shouldn't get treatment? So you shouldn't treat them as an equal human? Like, no.
So I referenced psychiatrization earlier, and that's because the perspective that I'm bringing to this, I knew I was autistic before I knew I was trans. I was part of mad people's movements before I was part of trans movements, and I come from that background. So when I say, let's stop thinking about trans as this specialized, weird little corner of psychiatric health that only very special people can understand and diagnose and treat, actually, there's forms of related mental distress that all sorts of different people can learn how to treat, and they don't need to be hugely qualified in order to treat it, and they should be treated like other forms of mental distress. That's the perspective I take on trans, on gender dysphoria. It's also the perspective I take on other mental illness.
Yeah.
It's also the perspective that I take on schizophrenia. It's also the perspective that I take on depression, that psychiatry as an institution silos people off into specialized areas, it has uniquely, apart from the police and the society, the ability to lock people up, of which lots of trans people have been as well. And I'm part of the movement that resists that broadly. But that's for another time.
It is interesting to see, because I think this is one of the things, and this is a tiny little sidestep, and we'll come back to Africa. But I think a really important thing that trans people need to do, activism needs to do, is like build more solidarity with other movements, because so much of our oppression in one form is very unique because it's a unique combination of them, but in another form it's just the same. Nothing we face is like exclusively in broad terms faced by us. We need to be allying up with like mental health advocates, or the MAD movement, or however you describe it. I hadn't heard that term before, so sorry. But also with like all kinds of other groups, like intersexual feminists and stuff, and like obviously the gay rights movement, and it's all just the same stuff. But anyway, so it is important to hear that it's got an overlap.
Yeah, to give people a little bit of context, if they're slightly uncomfortable with my language there, like MAD has been reclaimed by a lot of us in the same way that queer has been reclaimed. So there is a MAD people's movement. And it's an important movement. It's not always a movement that its end has necessarily built particularly good links with trans people. And similarly, trans people have not always been very good at building links with mad people. And I'm trying to do some of that building of links, as other people are, not just because they're good fights that are good allies to each other, but actually because we're struggling against the same system. Yeah, I know that's what you're saying too.
And also because it's good to care about people. Like, even if we weren't fighting the same system, it'd be like good that people who aren't me also get a good life. But anyway, yeah.
And similarly, I'm just adding some caveats in case anyone was freaked out by I think I referred to autism as a disorder before. I don't consider myself disordered, but that's what psychiatrists say about me. Right. So just to be clear about why I'm using language that I'm using. So, abolish the GIC, de-psychiatrize transness, and make access to healthcare part of the broader access to healthcare that everybody deserves within our public health system.
So are there any other countries or regions which have either this or much closer to this? Is this the international guidelines or?
The World Professional Organization for Transgender Health is a site of struggle. It is generally moving in a direction. And its latest guidelines are not yet out, and it remains to be seen how good, or rather how less bad, we've managed to make them. It's generally moving in the direction of informed consent, especially for hormones, but really for as much transition-related healthcare as we can. What we mean by informed consent is that the decision about whether to prescribe something, say hormones, is taken between the doctor and the patient, with the patient strongly empowered in that relationship. And the role of the clinician in that is to explain the likely effects realistically, to set realistic standards for them, and also to explain the risks and things that might go wrong, and what some of that might be, in a way that the patient can fully understand. And then the patient themselves can make the decision based on the balance of benefits and risks. And that's what we mean by informed consent.
With the knowledge of the risks and with the knowledge of the treatment and all that kind of stuff, but also with the trust, because I think, like we were saying earlier about how you often feel like the pressure to lie to the gatekeepers. I think an argument for this model is the fact that when people feel pressure to lie to gatekeepers, sometimes they feel pressure to lie to themselves, or they have to go further in certain treatments in order to meet a stereotype to get any healthcare at all. So, for example, an extreme case of this, I know, I think 2 or maybe 3 trans women who had GRS and didn't want it, but they lived in a time and a place where it was like, if you don't have GRS, you can't have hormones, you can't have speech therapy, you can't have any support at all. So they had to just agree to this, and they lied about wanting surgery in order to get hormones that they needed. And so you need to be able to trust the doctors in this, in relationship, to give an informed consent. But also, I think a lot of people think, well, if we don't have all this, if we don't have gatekeeping, then people won't know what they're doing, and they'll make their mistakes, and there'll be more regret and stuff. But the thing is, if you have a situation where in order to get healthcare, you have to wait 7 years and go for a load of gatekeepers you have to lie to, and maybe even sign up to healthcare you don't want, and the alternative is cheaper, quicker, and etc., is DIY, then people will do that. And then they aren't informed, and it's not informed consent because they're just buying stuff off the internet. So informed consent is the model where you can talk to an expert or a doctor at least, who can use their expertise to inform you of all of the situations, give you information you can trust, and make it clear to you that, you don't have to rush into this or whatever. And then that reduces regret, and it also reduces people doing the wrong things, even though they know in advance they're going to regret them, just to be taken seriously.
I'd say that right. And I'd say that's right. It's a question of building patient capacity. It's a question of building trans people's capacity, or people who experience gender dysphoria's capacity, to make good decisions for themselves in a situation where they can trust their healthcare system. I'm not going to list the European countries because I'll get it wrong. I would say TGEU, Transgender Europe, has a pretty good map of trans rights and healthcare practices in different countries, and you can have a look at where diagnosis has been lifted as part of medical processes there, and that's quite useful. And another good comparator then, which a lot of people within the Anglosphere might be more aware of, is North America generally and the US specific. Now, to be very clear, I would not exchange our public health system for the North American system in any way. However, there has been built a network of informed consent-based clinics for transgender healthcare within North America that has been practicing for a number of years. Paradoxically, I would say that's partly been created precisely because of the murderous awfulness of the US healthcare system, which means that the necessity of civil society stepping into that place to some extent has ensured that something else has been built. Again, I'm not saying that's a good situation to be in. And it is that North America similarly has a tiered healthcare system where if you're even if you're just upper middle class and above, you can access trans healthcare. If you're anything below that, you haven't got a chance within North America, because you haven't got a chance of accessing any healthcare within the US, I should say, not North America.
Yeah.
So we can look to informed consent-based practices, and we can look to organizations like the Center for Excellence in Transgender Health, which is based in California, I think. In San Francisco, I think, which has really extraordinary good practice guidelines for trans health, which are outstrip anything that you can see either in the UK or within WPATH, the World Professional Association of Transgender Health. They're still not perfect, but they're a long way forward from where we want to be. So informed consent is very well established practice. Alongside that, and this is related to those comments about the US as well, I don't want to give the impression that everything that we want can be solved within just the NHS structures as it is, or just by moving trans healthcare into primary care as it is, because exactly as you've demonstrated, even GPs and pharmacists and so on can be sites of prejudice, not just towards trans people, but I want the NHS, I want to keep it. It is still a paternalistic structure, and it is still rife with racism, with ableism, with transphobia. And if everything that we want to access is only through that, then it is still going to be a racist trans healthcare system. So we need to be building alternatives to that at the same time. And that means building community health clinics that are run by trans people at the same time. This is stuff that's already been happening both outside of the NHS and alongside the NHS. So you can look to projects like Clinic Q in London and 56 Dean Street in London. And you can look to projects like Clinic T in Brighton within the UK, which have been ways of building community healthcare for trans people, either outside of or kind of working with and through the NHS to build services for us that are run by us, because it's really only other trans people that we can have at this point enough trust in to do that. Yeah. So we need to be building our own healthcare services at the same time. We can't be looking to the NHS to do it for us. Another sort of criticism I would make about British healthcare in general is like our very veneration of the NHS, which again, we need that institution and we need to try and bring it out of the crisis that it's been put into by years and years of Tory government, which is a deliberate dismantling of public health. It is a paternalistic organisation, and we tend to have we tend to be quite paternalistic when we think about it. It's not going to solve everything for us. We have to be building our own healthcare as well, and that means us doing work on the street. It means us building resources for people who do self-medicate. Doesn't mean people going on social media and be like, oh no, self-medicating is very dangerous. It means building harm reduction resources for people who self-medicate, because self-medication is a reality. It means supporting people in their healthcare needs and meeting them where they're at.
Yeah, definitely. I think I like come from, I guess, okay, my family sort of moved into middle class, I guess, but I came from quite a healthy situation. I didn't have to deal with the doctors as much. I have asthma, but other than that, that was my like only experience really with the NHS growing up. And I just had this kind of idea of like, if anything goes wrong, the doctor fixes it 100% of the time. You can trust the doctors. They know what they're doing. You just walk in, they just fix it. And then I had, in my like early 20s, I had a really bad repetitive strain injury from too much keyboard. And that was exactly that experience. I walked into GP, I was like, can't use my hands, they're too painful. They referred me to a specialist. 2 weeks later, I was seeing like one of the best people in the country. They fixed it. And I was just like, NHS is just like perfect. Like doctors are just, like, I just go in and they just tell me what to do and now I'm better. And then, so when I started approaching trans healthcare, that really sort of coloured my view of it. And I'd hear people saying, oh, you should DIY. And I just get this feeling like, oh, this is absolute madness. Like, why are you recommending people who have no idea what they're doing take random medicine off the internet? And now after going through the system with all my privileges, I still don't know if I could ever recommend DIY to anyone, but it's an absolute reality and I completely understand why people do it. And it's always going to be the case until we have a better system. And if you're someone like a cis person or even another trans person who's horrified hearing this idea of like DIY healthcare is a reality and maybe even supported by a lot of trans people, and you don't like that, then the solution is better healthcare services for trans people. It's not trying to ban DIY, because the harder you make it, it doesn't stop people doing it. It just makes it even more and more dangerous. And it's exactly the same with trying to ban abortion, and often from the same people.
Look, we've got to the point where white trans people like us will tokenize and hold up our street queen ancestors as supposed beacons of our movement, and then people like us will also go on social media and be like, oh, but DIYing is very dangerous. How do you think these people transitioned? How do you think they did it? DIY is a long established practice within trans community. I would never recommend any particular healthcare practice over any other healthcare practice. I would say we need a harm reduction approach to DIY. We also need a harm reduction approach to people engaging within the GIC, because as we've discussed, the GIC enacts harm. So we, as a community, have to develop bases of knowledge and strategies for providing better healthcare to each other, for building the knowledge so that people who do DIY, and I mentioned earlier, I've done it as well, so I'm not talking from a place of ignorance here, so that people who do DIY have access to the resources they need. That means needle exchanges, that means free blood tests, that means some understanding about how to self-titrate, that means some understanding about how to look for side effects, it means some understanding about how to check your sources so that you have some idea of what you're putting into your body. And for people within the GIC, we have to have strategies like, how do you work with a psychiatrist so they don't screw up your meds? Like, I have friends who've been put into forced menopause, trans women who've been put into forced menopause because their endocrinologists don't actually know anything about trans women's hormones. And I've had to say, oh, the reason you've got headaches and hot flashes and fatigue is because your hormones are too low. Yeah. You need more hormones.
Well, because that's another thing that kind of won me over on this, the reality of the healthcare situation is when I was discharged from the GIC and I had that running with the GP, and then I saw a different person, and I got my blood test results back and they looked at them and they were like, well, yeah. I was like, well, are they good or bad? Do I need to change medication? They're like, they know less than I do, honestly. And that's not me like thinking I know more than doctor. I know fucking nothing compared to an expert on, endocrinology or whatever. But the random GP who is in control of my health knows nothing. So I have to know. It's already effectively, it's just DIY, but with an official stamp on it, really, in some senses.
A slogan that I use sometimes is that all transition is DIY transition to some extent. think we deserve public health. I think we deserve knowledgeable support within a well-funded public health system. I think that our clinicians, when they're good clinicians and not abusive psychiatrists, deserve good pay and good working conditions. I think all of these things, at the moment within the UK, all transition is DIY transition, because you have to learn, even if you're in the GIC system, as you've exactly said, you have to learn your own healthcare. And you can only really do that with other trans people.
Yeah. Yeah. So, right, just before we move on to the other positive thing, I just want to make one point about that thing you just said there, is that sometimes I encounter people and be like, oh, we should have trans people in charge of trans healthcare. And they'll be like, what? Like, trans people just want everyone to transition. Like, just step back, mate. If I said I think women should be in charge of women's healthcare, does that sound mad to you? Like, if it does, then fuck off. But if it doesn't, like, I think that's quite, of course, like, women should be in charge of women's healthcare. Like, it's just so obvious. And same with anything else. Why not? They're the people who know best about these situations and are able to talk to the patients in a, in a better way. I think it's just straightforward. But often when you say it, people are caught off guard almost by the idea. Like, why the hell are a bunch of cis people who ask all these dumb questions like, do you have sex with men? Why are they in charge of my healthcare?
Yeah. And for anybody who's accusing me of being gung-ho in all of this, I'm not. What I want is good healthcare for anyone who experiences gender dysphoria, or anybody who wants to transition, or anybody who doesn't want to transition but is thinking about it. And that means people who transition and are happy. It means people who transition and regret. It means people who think about transition and don't transition. They're all part of my family, and I want them all to have good healthcare. I want people to be able to make decisions about transition in good circumstances, where they can consent, where they are informed, where they do have trust. I want all of that. I want better healthcare for detransitioners who face exactly the same healthcare hurdles that we do.
Often with even more discrimination.
Exactly.
And less community.
Exactly.
Yeah.
Yeah.
So I would love to go off and start talking about detransition and how they are part of trans healthcare, but we did promise to end on a positive note. So what is happening? How are we saying?
I think we'll be moving in that direction. Okay, yeah. So I've got a bit of a recipe. I just want to give a shout out actually to the young folk at Turn Up for Trans Health, which is a new little, why am I being patronizing? A new and powerful activist formation that has just happened suddenly in Edinburgh, who organised a really fantastic demo at the Scottish Parliament last week on Friday, and got a turnout of, I think maybe it was like 150, 200 trans people, mostly young trans people, which makes me, as an aged crone, really, really happy. So congratulations to them, and thank you, and I hope we can keep building a movement. There's loads of people that have been doing work in Edinburgh for a long time, and yeah, it's nice to see some more folk coming in and doing stuff. So I mentioned that because I gave a little stump speech there where I gave people a recipe for like what we're going to do about trans health. So thing number one is we do need protest, and what we need is militant protest. We need to build on the success that we've had already with the kind of celebratory static demos that have happened recently. We need to learn from the activist groups around trans healthcare that have happened in the past, like Action for Trans Health. And we need to be stepping up our game on that, okay? They're not going to listen to us if we just stand nicely outside of buildings and shout and ask for better healthcare. We need to be taking inspiration from our forebears, like ACT UP, the AIDS Coalition to Unleash Power, and talking about things like die-ins in gender identity clinics. I'm talking about things like picketing the offices of transphobic GPs. I'm talking about things like invading the health boards that set our policy. You can choose, if you're going to do any of this stuff, what side of the law you want to be on. And if you decide to go on another side of the law, please speak to people who know what you're doing.
I'm going to just say, don't do anything illegal, and absolutely don't do anything violent, and don't put anyone in danger. And talk with people who know what they're doing, because should all.
again, I mentioned this stuff, like I mentioned this stuff about DIY, as somebody who's been involved in environmental direct action movement, about somebody who's been involved in anti-fascist direct action movements. And I've been trained and I've learned and I know some stuff about the law, and I'm not an expert, but I don't go into this stuff without any experience. So when you're thinking about activism, think about that stuff. I do think it is necessary for us to pick up the militancy of the trans healthcare work that we're doing, because there won't be change unless we make ourselves trouble, and there won't be change unless we force change. So I do want to be trouble. I think I kept you on the right side of the law there, Katie. Did I keep you on the right side of the law?
You better have.
I hope I listen, send me the legal bill. It's fine.
I think that there are there's, you know, that when you say protest, that could be, I mean, it could be standing silently, smiling, just being like, trans, please. But like you say, making noise does better than that. And then sometimes strategically protesting in the right place is more aggressive.
Sometimes it is. Listen,
and it moves
read
up.
Sarah Schulman's history of ACT UP and what worked in it and what didn't work, because that was a queer movement to win healthcare for a deprived population. It's a different context, but that's a very important history. And she tells that history well, and she talks a lot about what tactics happened when and how they work. And that brings me to the second part, and that I agree with Sarah Schulman that the change that we want doesn't happen just through militant protest. We also have to get ourselves into health policy meetings. We also have to get ourselves into the rooms where decisions are being made, and insist over and over and over again that we, exactly as you said earlier, that trans people have to be in charge of trans healthcare, and we have to be part of the decisions that are being made about trans healthcare policy. Not just consulted, not just given a form that we can fill out, not having our opinions filtered, but in the room where decisions are being made. That's very hard work. It's grueling, it's tiring. It means putting up with a lot of crappy structures, but we need more people doing that. And we need people consistently doing that. We've had people doing that for years, for decades. We need to build that up if we're going to sort the problem that we've got now. And there are structures that you can get involved with. There's some stuff happening in Scotland, which if anyone wants to chat about the policy things that are happening in Scotland right now, hit me up on social media. I'll talk to you about them. There's some stuff happening in England. England was recruiting for people to be part of its patient oversight board of gender identity services recently. I saw that one. If you keep an eye on the policy processes in your country, in your local area, you'll often find opportunities to get yourselves in the room. If there aren't any, you can make those opportunities through protest. You can force yourselves into the room and demand to be in there. You won't succeed just by protesting. You use protest as a means of getting people in positions of power where they can make the actual changes.
And I think it's important, like for multiple reasons. I mean, obviously, just like a step back common sense view, of course, we should be involved in our own healthcare decisions. And it's ridiculous that like 99% of all the people in history have ever made any decisions on trans healthcare have not been trans people. But also, it is important to know...
That's an optimistic estimation.
99.9 plus. But like, yeah, it's probably just 100 to be honest, isn't it?
Sorry, I totally derailed you there.
No, I was just saying, particularly when it comes to trans kids, but to all trans healthcare, the anti-trans people are trying to do this already, and they are succeeding. They do get people into these decisions. They'll get a gender critical person. Work like they had a thing come up at the job opening come up at the Tavistock Clinic in England, where the trans kids are seen, and a openly gender critical person applied for it and got denied. But like, they're trying to do it. They've got no shame at all. They would absolutely be like, I hate trans people, and I want to be in a position of power which makes decisions about trans people. They're obsessed.
If I had one tip for anybody, it would be like, take half an hour a day that you might spend fighting gender critical people on the internet, and instead research how health policy happens in your local area. It's a bit more boring, and it doesn't give you like immediate hits of satisfaction. It gives you long-term satisfaction when you know that you've been part of changing policy. So I've given you item number 1, which is protest and protest militantly. Item number 2, which is get people into positions of power and support those people in positions of power that can make decisions about trans healthcare. Item number 3, and this is the last item for like my plan, my plan for fixing trans healthcare in the UK. Other plans are available. We do need a diversity of tactics. Please develop a diversity of tactics. I can't possibly have all the answers.
For a diversity of tactics, you need to start with one tactic and then find a second one. So this is a good place to hear for lots of people who have no tactics. So
yeah. So item number 3 on my list is, as I said earlier, we should be continue building on the resources that we already have to build our own healthcare. We have to be building outside of the system as we are trying to change the system as well. So have a think about where your skills are. Are your skills in making zines where you can share healthcare information? Are your skills in working with people that run drug harm reduction clinics and ensuring that they can provide harm reduction for trans people who are self-medicating as well? Are you a good administrator who can offer administrative support to people who are building trans healthcare systems? Do you spend an hour a day on Reddit answering trans healthcare questions, which is the thing that I have done in my life? That is building autonomous trans healthcare, but we need to be doing more of that. We need more people doing it, and we need to be scaling it. In all of these 3 approaches that I've talked about, protesting militantly, getting people in power, and building our own healthcare, make sure you also are researching who else is around, who else has been doing this work, what work has already been done. I'm often guilty of this. Often I can get very excited about something and start doing something and then realize other people are already working on it, and I actually need to work with them as well. So find out what's going on in your local area, find out what's already been done, reach out to other people, build networks for doing this. If you're a total solo person, that's cool. Find the kind of stuff that works for a solo person. But we're only going to achieve any of this if we're good at playing on all of our strengths, if we're working together, if we're building links, if we're building community, and we're supporting each other in this work. And I believe that we can do it. Like I've made it my mission to be part of building a better trans healthcare system in my life, because I needed it, and all my friends need it, and everybody that I love needs it. So let's do it. Let's make it happen.
Yeah, and we can make it happen. And like one thing I think always helps is looking back at the past and seeing how far we've come. I mean, like you were saying, lots of the sort of like trans heroes from yesteryear or whatever, they were all DIY, and their DIY was often absolutely mad, like the lengths that people had to go to get any kind of healthcare at all. And then, like people were sort of fleeing from getting put in a psychiatric ward or whatever, locked away and stuff. And we obviously progressed from there to the horribly restrictive gatekeepery system of the GICs. But even that is got better over time with people's pressure. I mean, it's still crap, but it means that there's so much room for improvement and so many different ways we can make this better. And we are like the sort of in the visibility time of trans rights and trans healthcare, where it's the first time that people are starting to know about this, and that means there's more of us than ever. It means there's more resistance than ever, but the resistance people don't know what they're doing. They don't know what they're talking about. They're just trying to harm us, and that means that they're unequipped to deal with all of the things that we know we need. So I think, we've come a long way, and there's a long way to go, but we're making progress, and it is positive. And also, like, such a state already that if you just like, it's like the early days, you can just turn up and do one thing, and suddenly you'd like made healthcare better for the future for everyone. And all you've done is abolish the GIC. It was easy.
I think the last thing I kind of want to say on all this is we talked a few times about risks, and occasionally we've had to give like caveats and stuff like, well, I'm not necessarily recommending DIY, and I'm not necessarily recommending that you go and invade a health board panel right now. Right. So all of this stuff that we're talking about has risks, and activism has risks, DIY has risks, going to the GIC has risks, activism has risks associated with it as well. So, I've been pretty gung-ho, and I've tried to rev people up a little bit, but like, as you're doing this, think about your capacities, think about what you need to support this long term, because this isn't something that's going to be solved in 6 months. It's not even something that's going to be solved in 6 years. I'm in this for the long haul, and that means sustaining the activism that I do over a long period of time. I'm not always very good at that. I've been through cycles of burnout. I've failed in all sorts of ways, often because of burnout. There's lots of times I feel like I've let people around me down, where I haven't been able to do the things that I want to do. And that's going to be part of this picture as well. So think about that as well, and look after yourselves as you do this work, and look after each other as you do this work, because that's also how we sustain this movement too.
Yeah, and I think whenever I talk to people about this, I always like to say, people say, oh, I feel like I should feel guilty, I should be helping, all this kind of stuff. My goal is that trans people don't have to do this. Like in the future, at some magical point in the future, they won't have to fight for healthcare, they won't have to fight for their legal rights, they won't have to worry about abuse and all this kind of stuff. And if you're in a position, and like the goal is to get trans people living a good, normal life, happy life. And if you're in a position to do that, or even just live an okay life, and do that, and that's a success. Like that's a success for everyone who's fighting. You're not like not helping. You're not like chickening out or anything. If you can't do this because it's not in your capacity, or you don't have the skills or whatever, or you just don't want to, that's fine. But I think most people do feel compelled to do it because they just know there's so much wrong that they know. And don't, just do what you're good at.
Listen, we've all got our transition goals. Your transition goal is struggle so that people in the future don't have to. My transition goal is like, I don't know, be part of like a lifelong project of revolutionary struggle against colonial capitalism and the state. Like, we've all got our goals, but we can support each other. We can support each other in doing it. So
yeah, I mean those goals are aligned, I think.
Yeah, I agree. I think allies.
For now. Oh.
Oh no, you'll be on the right side of the barricades.
Yeah.
I trust you.
But yeah, so we've just gone over an hour, and I think it's been a really good discussion. I think it's always good to vent it out, but it's also good to just like, you can't fix things until you look at the situation they're in to start. So that's an important first step. And that's going to involve hearing from everyone, because like when you just have two like white trans women discussing it, like I didn't even know there was voice therapy for trans men. Like how can I be I couldn't be the perfect advocate. So we need everyone involved who has a voice on this, with all your different perspectives, and then we can actually make a difference. And this is, part of it. So I think it's good. So thank you very much for coming on and sharing your expertise, your doctorate in poetry, with the with everyone watching. And I hope this has been really informative for everyone. Do you have any like closing words you'd like to discuss? Or
I tried to give the inspiring closing word speech twice already.
Oh no, sorry, you're trying to finish up.
I can't do it a third
Would you
time.
like to plug yourself? How can we find you? What's your poetry?
Oh, do you know what? I should probably drop a link to the GoFundMe, shouldn't I?
Yeah, whatever you need.
I mean, I'm
put it in the
fundraising
description
for my own trans healthcare, because I can't afford it. So myself and my boyfriend Darcy are fundraising for our own trans healthcare and other people's at the same time. So we're raising 30 grand, trying to raise 30 grand, and a third of it is for me, and a third of it is for Darcy, and a third of it is going to other people's trans healthcare.
Well, I'll definitely put that in the description below. I've put all of your links in the description below to follow. And it would be great if anyone would like to help out on those things.
Any of that would be extremely welcome, and you can find me at Josephine Giles on Twitter, and Facebook, and Instagram, and those places. Oh, really? Is it about? Oh, you've got the green screen. That's great. Thanks so much for the space to chat about all this, Katie, and all the best to you, and lots of love to everybody who is out